Welcome. Thank you everybody for coming. I'll try to speak up as loud as possible, but my name is Grant Norton. I'm the Director of Rev Cycle Process Improvement at St. Mary's Hospital in Amsterdam, New York. What I'm going to focus on today is how we simplified our revenue cycle with some integration of some automation, some AI with SphereGen, how that improved our cash flow, our days in AR, self-pay numbers, and days to get a statement out the door for a patient. So, who is St. Mary's? St. Mary's is located in upstate New York, about 40 miles west of Albany, New York, if anyone knows where that is. We're 3 hours from the city, upstate. We're a long-standing community hospital. We're a disproportionate share hospital. We have a 70% Medicare Medicaid population that comes to the doors. So it's tough to get money, it's tough to get bills paid, especially with co-pays, deductibles, as those go up. We transitioned to Meditech Expanse in 2022, and went from, actually switched billing methods, went from method 2 to method 1 in April of 2025, and we're still in that progression to do professional charge forwarding from our acute side to our ambulatory side. So in the news, commercially insured patients, so deductibles, copays are going up constantly. I think we all are aware of that, and the ability to collect those copays is going down. People are unwilling to pay their patient balance. I think it might be, so in New York State, we're not allowed to report to credit agencies anymore, so it's very tough for us to have the, prove to patients that they need to pay their bill, and I think patients are getting on the trend that they know they don't have to pay their bill in New York State in particular. So it's hard to get people to pay as deductibles and copays go up. So addressing some operational challenges with getting people to pay their copays and deductibles. Mark Cuban has highlighted that doctors, hospitals are often subprime lenders. So we're taking on all the credit risk, and then we have to try to go after the patients to try to collect that payment, which is very tough, especially when you have a long stay in a hospital. Could be a very emotional situation. It's hard to get patients to pay. The CEO of Starbucks has also talked about streamlining, removing less popular items from menus at Starbucks. That goes hand in hand with hospitals. We need to streamline, figure out ways to get patients through the door, get them to pay, easy, simple ways, remove the barriers to care. So this is a complicated workflow that we live in a hospital in a day-to-day. This is what my staff are constantly working through daily, manually, trying to contractualize balances in our system to get a self-pay statement out the door. We don't send a self-pay statement until we fully contractualize the insurance bucket in Meditech. We don't want to send a patient a statement for $25, their insurance comes in, reprocesses or processes the professional portion, leaves an additional 10. We don't want to have to resend a statement. So we want to get it right the first time. The big thing is, this is so hard to work through with 70,000 accounts in our system, with balances hanging out there, that our AR prior to 2025, prior to 2024, over 180 was about 25% of our AR was just hanging out there. So it's very hard to move through the process manually, daily, because you can't expect your team, even on a good day, they can probably get through 100, 130 accounts a day, one person. So to get through 70,000 is almost impossible. So our challenges, it's very inefficient. We had a huge backlog. Our AR was tremendously out of date. AR over 90, AR over 180, even AR over 365, way too high. We were not even close to benchmarks. We tried to benchmark against HFMA. We were really looking at AR over 90 to be less than 10%, AR over 180 to be around 5%. We were nowhere near that. So we had a lot of different errors tying us up. Resources is a huge thing. I think we all struggle to get people to work for us, especially in high demand roles that maybe potentially don't get paid a lot to do the work that's necessary, because these are very challenging jobs and definitely complex workflows. So what we need to do, we need to improve our cash flow, because as we know, year over year, copays and deductibles are going up. We need to collect that cash as the lender. We need to be more efficient. If we lose staff, if we need to add more staff, we're losing knowledge every day as people come in, come out the door. So we need to, truly be efficient, understand where our weaknesses are, and keep moving forward. And then we want to retain knowledge. All this needs to be documented. How do we update our contracts? How are we maintaining, what are we looking at with payment-wise? So we had options. We either add more staff to try to keep retention, and as people go out, at least we have a few extra we can shift around in different payers. We can write off contractual allowances and we won't know if we got paid right. We can outsource work, which can be very expensive, or we can automate the process. So we chose automation. It's cost effective. We're not having to add staff. We're not outsourcing, and we can do it all internally and update it ourselves and understand what we're doing. So it's efficient. We cleared our backlog in just a few weeks, and we're investing in technology that can go throughout the entire hospital. It was a proof of concept for us. So how do we get there? We partnered with a company called SphereGen. We reviewed our current process, that huge manual flow. That's the process that we now are going to have a bot do in our system. We established our in-house environment, and our focus with staff now is working high dollar, important denials and appeals, and getting rid of basic contractual allowances that are bogging up and bottlenecking our staff. So what does the bot do for us? So it pulls our entire patient accounting list after an 835 file comes into our system. The bot actually does two things. It posts that 835 file for us. It then works the balance to see, make sure the self-pay balance is in the correct bucket and the amount is correct. And then, secondarily, it'll actually work that account. And if the amount is within a range, so we say if it's within $24.99 and it feels like that got paid appropriately, it takes that full contractual and we get the self-pay statement out the door. So it's doing the entire workflow from posting the 835 file down to getting the self-pay statement to the patient without any manual intervention. So it's about 63 to 65% success rate. It works almost, right now it's working almost 11,000 accounts a month. I think last time we checked it was working 10,800 accounts in a given month. So, I mean, that's probably 5 FTEs. It's crazy how massive of a help it's been to our team. And so the big thing is we're a growing organization. So we're trying to figure out how do we maintain our staff, and say somebody goes out on leave. It's very hard to pick up the slack when you have an important team member that works, Medicare or Medicaid. How do we keep the train moving without, losing and having our AR grow? And this is the solution. Right, we keep our current staff. We're not outsourcing anybody. We maintain the services, the jobs in the community, but we're supplementing it and saying we're going to make your lives a little easier with some AI and some robots in our system. So past to present. So our AR days, when we first started this, were around 55, 56 days. We're all the way down. We just hit 39 days, and I think we were just at 38 last month. Clean claim rate has gone up. Average day to statements has gone down. When we first started, our average day to get a statement to a patient was 108 days from discharge. So from discharge, it took us over 100 days to get a self-pay statement to the patient. Imagine, you as a patient getting that statement and saying, when the heck was this from? We're now at 46 days. So from discharge, and the average day to pay is around 35, 36 days from an insurance company, if it's a clean claim. So from discharge, 35 days, we're right at 46. So pretty shortly after we get that payment in the door and that 835 is posting, we're getting a statement to the patient. And that's that. So, when we initially started, our top end was 91. Even before that was 108. So that's how quickly now we're getting a self-pay statement out the door, because we're able to automate the entire process of posting an 835, working the account, and sending a statement. On top of that, we also switched our billing method. So we went from method 2 to method 1. We needed to get away from a professional claim and a facility claim, because we're all hospital based, from going out on a single account. We wanted the professional charges to be on an ambulatory account and have the professional charges separate from grouping to an APG, APC, and billing out on a facility UB claim. That has also helped us a ton, because we really wanted the professional charges to get out the door extremely fast and then come back extremely fast. The facility side is obviously a little bit more challenging, because you have to group it with Medicare and make sure that payment it's a little tougher to get paid on that side. Professional charges, fee for service, it can move pretty rapidly. So what we gained from these two things, and mainly the automation process, is we freed up more than 8,000 hours a year with accounts receivable, especially. That's such a manual process of posting A35s. Our projected cost savings is over $300,000, and over 10,000 transactions a month are wiped off our system because a bot's doing it for us. So overall gains, there is absolutely no manual intervention there, so we know it's spot on and we don't have to worry about it. We update our contracts in the back end of the bot, so if, say, somebody updates Medicare HMO plan is saying we're gonna go to 105% Medicare, 110% of Medicare, I just plug that in. Bot picks it up and runs with it. There's no calling an IT vendor, calling somebody and saying, hey, can you change the code? Can you update this? I do it. It's in Excel files. The bot reads it, grabs it, and does it. So it's very easy to pick up as a normal, I can't do any IT, but I can handle the updates when needed. So what we're doing now is we're really trying to get our A35 process streamlined. So it has posted over 100 A35 files already. That's a very complicated process with A35s coming through because there's so many different variations of how payers transmit them to you. But that's having even more success than contractual allowances. That's having almost a 90% success rate. It's posting flawlessly almost all of our A35 files without any manual intervention. So that's awesome. Our next thing is to continue to move this along in rev cycle. So New York State has a big thing called episode of care. Other states probably have it as well, where depending on the date of service, those have to move back to the original order date and be billed on a single claim. So we're gonna leverage a bot to go into our system, look at the dates of service, look at the charges, move those charges to the correct account so we can bill the New York State Medicaid. So no more manual intervention there too. So lessons learned. We need to get our IT team involved early on this, just because that's the general big lift. If you get your IT team involved quickly, it's very simple. Once they're involved, I really took over after that because once we stood up the server and being able to get them in the system, it's a simple process. And then staff morale. So our team is so much more happier now that they have the bots moving in the system. I think initially they're afraid, right? They're afraid that with AI they're gonna lose their jobs. The big thing is we wanted to keep our staff. As we grow, we just knew we need to be more efficient and we need to be more timely with our contractual allowances and how we work. So now we have our accounts receivable team. We're completely redoing their workflows. We're gonna have them focus actually on appeal management, high dollar denials. Our billing team now can focus on high dollars, seeing billing follow-up, what's going on in the clearinghouse, edits that need to be made, trends that they find that they can then come to a claims analyst to update a claim format, things like that. We don't want them spending their day just contractualizing 100 accounts and then we have to audit them in the back end to make sure they're doing it right. With a bot, we know it's doing it right, it can't mess up. No, I'll bring it to Ted.
I'm Ted from Surgeon. We worked with Grant and the St. Mary's team. And thank you, Grant. One of the things that we always talk about is when you're bringing the AI into your hospital is start small, right? Start with a small project, but this was a proof of concept project. And we worked out how the AI bot, we are essentially AI trainers. That's what we do. We come in and train the bots and we set up, like, for Grant's example, we were in an Excel spreadsheet where you could change the business rules easily. The bot needs to learn. It needs to learn from Grant and his team. So the AI bot, we are continually tweaking it, changing it, but we make that easy for you to do. One of the things that, as you are looking at deploying AI into your organization, is to, as Grant said, partner with your IT organization very closely, because they need to be understanding security and how that all works. But figuring out what you want to do on a start small and get small wins and move forward from there.